I have a question from Raquel Vallejo. Why are pellets not FDA approved?
Okay. Um, Pellets are not FDA approved. I tried to talk about that to a certain degree. Can you guys hear me?
Yeah, I can. Everyone can hear you.
Okay. Uh, they're not FDA approved, and it mainly has to do with money. Drug companies are not going to, if they cannot change a compound to a certain degree, add a hydroxy unit or add a little something to it to change the structure of the compound and keep it effective, they won't be able to put a patent on it. And see, these medications, these pellets have been around since the 1940s. So, and they're all natural. It's kind of like why are some medications over the counter? Why are they called medications? Why are they called supplements? Well, some of these supplements, there's nothing you can change with zinc, for instance. I mean, zinc is zinc. So if you can't put a patent on that zinc, you can't, so it's not going to get FDA approved. As far as drug companies will put a lot of money into their patented drug to try to get FDA approval to get it on the market, to start writing prescriptions for it. And, it's sad because one of the largest things that we've seen with that, for example, is colchicine. Colchicine in treating gout. Well, that medicine has been around since the Egyptian times. I mean, years and years and years ago. But the thing is, patent went away, no patent on colchicine and this and that. And since then somebody bought colchicine and added a little compound to it and called it Colchris, put all this money up, and then the price of colchicine went from $10 up to $250. So that's basically why it's not FDA approved. But you can't just go by FDA approval, and that's why I've emphasized this on several occasions with other talks, is that you go by standard of care. Okay, the more people, the more physicians, medical specialists that are doing natural hormone pellet therapy and doing it correctly and seeing good results, it will become the standard of care, to where FDA approval. I mean, we do several things that aren't FDA approved, but are standard of care. So.
All right, thank you, Dr. Triboni, for answering that question. The next question is, can you discuss, it's actually coming from Chris Amato, can you discuss the increased risk of breast, uterine, ovarian cancer often associated with these treatments? This question comes up a lot and scares patients. How do we talk to them about this, and what studies can we provide them?
Yeah, I think that what you've got to realize is that, number one, there's different hormones. Okay, so there's different concerns. Okay, I think this is another thing where I think, unfortunately, the synthetically made products, taken orally for the most part, are the ones that are of the most concern as far as the studies that have been out there. These are larger studies because these were patented drugs. There's been studies since the 70s on estrogens that have actually shown a lot of bad things, actually. There was a Swedish study back in 1989 in the New England Journal of Medicine that basically showed increased breast cancer in estrogens, certain estrogens, the conjugated ones, the oral, the Primarins, this and that. And if you took estrogen plus a progestin, see, there's a difference between natural progestone and progestin. The progestins are medroxyprogesterone acetate. So if you were taking that in combination with estrogen, there was even a doubled risk in that study of breast cancer. There was a trial in 1998 where they studied to look for heart disease and would hormone therapy prevent heart attacks? And it said it did not prevent heart attacks, that it increased risk of a second heart attack. These are the problem with a lot of these oral medications that drug companies are pushing is they're giving estrogen in a very, very, very large amount, number one, okay? Number two, they're not giving it as a stable human-like form. They're adding a hydroxy group. They're adding a medroxy group. They're adding these groups to it to get it patented or whatever. But the problem with that is horse urine-based hormone is not the same as human hormone, okay? But the plant-based, the soy-based hormones that we are using for pellets, much lower dosaging, most uniformly spread out, and there's smaller studies because the FDA won't get involved, but the studies have shown no increased risk in cancers with these pellet therapies. Now, because 85% of lawyers in the world live in this country, there's still the risk and concern about, they don't know what we are knowing about hormone pellets because they're not using them. I have a lot of gynecologist friends that they're like, oh, that's just, that doesn't work or this or that. But they don't give a why to their answer. The answer is they weren't trained in it. They're not doing tests. They're not doing it. They're not doing any studies comparing pellets to pills. And they're not checking levels on pellets. So they're not, when you check levels on pellets and you see a good subtle normalization of hormone values, you see a lot of improvement in how people feel. Because see, there's not hormone just, hey, I've got hot flashes. Because we said low estrogen, low estradiol, high estrogen, and low progesterone, all of that can cause postmenopausal type symptoms, perimenopausal symptoms, not just estrogen alone. So, there was a huge study, especially on the medroxyprogesterone, which is progestins, Progestins. That is not progesterone, okay? So when you are seeing people getting on the Proveras and this and that, the medroxy component, there was a huge study that had to be stopped in 2002 because they had estrogen and medroxyprogestin combination. There was a 26% increase in breast cancer. There was a 30% increase in heart attacks. There was a 41% increase in stroke, and 200% increase in blood clots. So what I'm saying is a lot of these cancer fears, if somebody has no history of cancer, if somebody meets all of the guidelines, they have all of these perimenopausal, menopausal symptoms, and they don't have this just rampant family history of breast cancer and other things, hormone pellet therapy is very safe for those people. Very safe. And I would tell them that. I would be bold to tell them that because of plant, soy-based, most like humans, and you're using lower, more steady state dosages, and you're following their levels. So.
Fantastic. Thank you for answering that, Dr. Trebani. The next question is from Chris Amato again. Do you screen or ask them about coagulopathic histories? And if they smoke, do you make them stop?
Let me see that one. I'm sorry, I'm looking at the question.
It's in your answer. It's in your answer. If you see the top, on the top, you're gonna see an icon that it says answer. It says, do you screen or ask them about coagulopathic histories? And if they smoke, do you make them stop?
Okay. The coagulopathies. That's another thing that I was talking about. That is predominantly a bad issue, especially with those progestins, no doubt about it. And I think that since I do not use that medication, I don't worry about it as much. But let me tell you, you can have most of the erythrocytosis and the things that you see is a slight increase there with the natural hormones. But you definitely want to ask about that history, get that history. And yes, estrogen, that's why I used to never, if somebody smoked, I wouldn't put them on oral estrogens at all. I wouldn't put them on oral estrogens. I wouldn't put them on birth control pills. I basically didn't do that because I said, you need to get off the cigarettes. With the hormone pellets, it's a little different in that the risk is much less, but I still highly encourage them to stop smoking because just because of what you are dealing with. You want somebody's hormone levels to improve. And it's kind of like, well, if I drink a 12-pack of beer every night and I'm trying to get your hormone levels where they need to be, it's really, I'm not going to keep going up on the dosages. You need to cut back some on the alcohol. You need to cut back on the smoking. You need to cut back on some of these things so we can get good hormone balance, if anything. And we're talking about hormone balance for perfect health. So of course, I'd like to get them off the cigarettes, not just for the coagulopathy concerns.
Thank you for answering that, Dr. Trevani. The next question is from Ragnan. Are there difference between total and free testosterone in items? Of which one do you use to start treatment and monitor treatment? Is there a role for free testosterone?
Yes, I answered that to a certain degree. I think that the best option would be checking, having the free testosterone and total testosterone levels checked. Like I said before, the free testosterone levels, a lot of times they are calculated in the lab, and you want accurate free testosterone levels if you're going to go that route. Free testosterone level checks are more expensive, but they will do that. And I believe some of these labs, I know with ZRT Lab, some of these compounding labs, if you ask them to check that specifically and not just calculate it, they will. It's good because that sees what is usable testosterone. That's what's there. If you have very, very, very low free testosterone and you have high testosterone levels, well, what that's saying is all of your levels are saturated by binding receptors. So yeah, it's good to it's nice to check a free testosterone level because there can be some sensitivity and some variability with that, but that's why there's such a wide range with total testosterone levels. But if you do that, it can kind of give you an idea, like if you have a normal total testosterone level and you have a free testosterone level that's low, you have room to work there to get that both the free up and get the total in the normal range, get it up a little bit. There's nothing wrong with that. Yeah.
Thank you, doctor. And the last question, so we can continue with our agenda, is from Alvarez. What do you consider normal testosterone values?
Yeah, that's a tough question because there's different labs. It's kind of like with thyroid levels. There's such wide ranges. Some have 260 to 1300. Some have 360 to 1100. I personally shoot for a goal of 600 to 850 if I can. But really what you do, like we said, perfection would be trying to get somebody's testosterone level from a neuroprotective standpoint, from bones, from other things, trying to get it to the range of a 25 to 30-year-old. Hi, Chris. Says, I have a 51-year-old female with hypothyroidism, well-treated. She is perimenopausal with hot flashes. She menstruates every few months. Would I start her on testosterone or testosterone and progesterone? I'm waiting for her results. She is active, no toxic habits, occasional wine use. She's been having a dyspareunia and vaginal dryness. Okay, that's a good question. So she's obviously perimenopausal, and she still has vaginal bleeding. I would, of course, we're checking levels. So that's extremely important because some of this can be hormone imbalance rather than just a deficiency in one or the other hormone. So when you're checking these levels, I would highly consider, based on what you find, I'm suspecting that a lot of her symptoms may improve with treating her with testosterone alone, especially if she's perimenopausal. But yes, there is a chance that the answer is yes to both, and that you may be giving a low dose progesterone with very low dose testosterone.
Fantastic. So that was the question from Lisa, I believe, correct?
Chris?
Oh, Chris. I think that we have different orders on the Q&As.
Oh.
Okay.
A lot of people may ask, in going with that, a lot of people may ask, what do you start? Like, how would you start with the women? You may want to, you'll be able to fit remember, you'll be able to fit 2 to 3 pellets all in one tract. Okay. So you may, of course, you're following the levels, but you may want to start with just 6 milligrams of estradiol, very low dose, and 50 milligrams of progesterone with or without a uterus, okay? And just 12 milligrams of testosterone, or the smallest dose provided by the lab, and see them back in 3 months, okay? You may want to, especially in men, sometimes you have to check the levels 6 weeks out, but that may, because with men, you may want to start with, you're starting with 200 milligram pellets a lot of times, sometimes 100, but usually 200. And you're starting with 2 to 3 pellets at a time. And then you check the level 6 weeks later. Okay. And then you can redo, the first cycle at 3 months instead of 4 months. And then otherwise it will be every 4 months thereafter. Okay. With the men, a lot of times. You can check pregnancy tests. That's important. Remember, HCG stimulates the LH, the luteinizing hormone receptors. So you definitely want to see if they're pregnant. And it also increases, HCG also increases testosterone production within the testes. So that can help maintain male fertility. We were talking about the negative feedback loop with giving testosterone over time with shrinkage of the testicles and other things. Well, this would actually, HCG can actually help with that and sperm production. So I think we've answered that. But.
Okay, good. The next question is from Lisa. For the patients that have issues with pellet extraction, what are you doing to prevent that? Are you requesting that the compounding pharmacy make changes with less of the preservative?
Well, I mean, yes, most of these good companies like Belmar and some of these other companies, they are making preservative, very low level preservative pellets. So yeah, perfection would be no preservatives, but I mean, the stearic acid and this and that, but there's going to be a small amount of preservatives in these pellets. But I would say that as far as the extrusion problem, I don't really, a lot of it depends on pellet placement. I really have not had, like I said, the very first time I ever did put pellets on, it was with my wife, and she has low buttock fat content. So it was very difficult to get the pellets in where I needed them to get, but I do not a lot of times see them extrude outward if you press it, if you do the procedure properly and hold them in place. I personally haven't seen that very often at all.
Okay. Thank you, Dr. Treboni, for that question. I don't know if you can see on the Q&A a question from Carol. It says, you say that oral testosterone is not recommended. I have several postmenopausal female patients taking ODT testosterone and love it. Is it because it causes liver problems? It seems to work. Is this
Yeah, here's the thing. That's a good question. Very good question. Oral, if you're talking about oral disintegrating tablets, then you're essentially talking about almost a sublingual effect. If you're talking about that. And with ODT, with oral disintegrating tablets, yeah, perfection would be no swallowing of the saliva, because then it's basically a sublingual effect. But here's the thing. Yes, you are essentially talking about the amount that hits the gut is digested through and then can have an impact on the liver. You know, high dosages of testosterone injections in men are very effective. You have to define how effective, define effectiveness. If it means, hey, I look very muscular, I look like Arnold Schwarzenegger, if you're talking about that, I mean, yeah, very high dosages are very effective for a while, but when you're talking about safety profile, it's best, the less you have to take orally, the better. That's why if you're taking oral progesterone, it should be natural oral progesterone rather than anything with that hydroxy group attached, such as some of the Proveras and some of the tablets that just too risky. There's too many studies out there that were kind of shut down and hidden, I believe, from drug companies in regards to some of these oral medications.
Thank you, Dr. Treboni. The next question is, what's the patient's lab cost average?
What's that again? I wish I could see that question.
What's the patient's lab cost average?
Okay, lab cost average. Okay. Okay, so the lab cost average, that is a good question, and that depends. I'm holding this up because I was squatting on the ground. Okay, so the lab cost average, it depends, of course. It depends on the panels, but there is a cost as far as I'm trying to find a better place to put this for you guys. Okay, here we go. Let's get this right. Okay, so is that better? Okay.
Yes.
Yeah. The laboratory that I use, the ZRT lab, for instance, that I use personally, what they do is they have an insurance price and then they have a discounted cost, lab cost, that's a cash-based price. Most of my patients do not get a lot of these panels approved through insurance. And so there is a cost there. So you have to take that into consideration when you're doing your consultation fee and you're seeing these patients and you're charging a certain amount. You can do one of two things. You can just give the consultation fee, or you can have a higher consultation fee that includes the lab cost, includes everything, okay, which would be a higher upfront cost, and then they don't have to worry about it anymore. If you're talking to them and they have good insurance, very good insurance, and they would like to try to go through the insurance route, well, what you can do is one of two things. If they've paid you, they can be reimbursed based on the insurance coverage. Okay, number one. Number two, what I would also recommend is that you'll have the kits that ZRT Lab provides. They'll send you the kits, okay, and you have them stocked. One may be about laboratory labs regarding sleep. One may be labs regarding weight, obesity. One may be, they have different panels based on cortisol, based on, other things. Well, if you, in the kit, there's a sheet that has all of the pricing on it. Okay. And so when you have they have smaller panels. They have comprehensive profile 1, they have comprehensive profile 2, they have cortisol checks. They have, it also depends on urine, saliva, serum, blood spot, it depends. I've found that the cheaper option and the best route to go as far as more accuracy than some of the other ones as a whole would be the blood spot testing, that the kit, you hand them the kit as part of your consultation. You hand them the free kit, okay? And then they take it home, they look at the pricing, and you tell them, you say, try to call ZRT Lab and try to get it approved under insurance. I mean, there's nothing wrong with trying it. There may be a delay of a couple of weeks or whatever, but it's worth it. I mean, if you can get it covered, because the labs that aren't covered by insurance, if you get the full comprehensive panel that you need, that I think that you need, that the one that doesn't require, that doesn't have thyroid hormones, thyroid peroxidase antibody, all of this type of stuff. If you just strictly leave the thyroid out for now, if you just check the other hormones, you're looking at anywhere from $200 to $400 for labs. I mean, it can be quite extensive. Now, that's the first lab panel that you do. Not your other labs down the road. You're not needing that extensive of a deal here, okay? But when you initially do that, that may be the cost. Now, those are insurance prices, because a lot of times if you say, I'm going to pay cash, the lab will work with you with that in two ways. Yeah, they can do, some type of payment plan, but they can also, they have a cash price to where they will knock about $60 to $75 off the price if you pay in cash. So that's the way I run things.
All right, thank you, doctor. Let's go ahead and answer the last question so we can go ahead and go with the consultation of your patient that you're going to be treating today. It comes from Jennifer. If high estrogen, what would be the course of treatment to level them off if not testosterone?
Say that again. If high estrogen, what now?
What would it be? What would it be the course of treatment to level them off if not testosterone?
Okay, that's a very good question, and I see that quite a bit. If people are, it's just like with the men on high dose that are overdosing basically on the testosterone because of the treatment offered at the time by their docs or whatever. These Premarins are typically very high dosages of estrogen, and so they may feel very well, but have that risk, some of those other risks that we talked about, especially clotting risks and other things. And so it is difficult. It is difficult. I found that women in general tend to be more patient about it and tend to work the program to try to get it down than the men on testosterone. But what you do is it's a process. You have to slowly go down on the Premarin, on the estrogen dosing. You get it down to the lowest dose possible. And while you're doing that, you can be starting and adding, at least from your compounding pharmacy, you can start adding some compounding cream that you put on the wrist, that you apply to the wrist. You can start doing that and making that slow switch. And then when they get to the point where they are only on the cream and the very lowest dose of estrogen, then what you can do is you can start adding the pellets, okay? And you can add testosterone / progesterone. You can add these others to that may help with some of the side effects anyway. And then it's a process, like I say, but then it's good to check levels. Where are they at on the Premarin that they're on? And I can guarantee you a lot of them are going to be way too high. Okay.
Fantastic.
And while we are waiting, if there's any kind of question that I can answer, maybe if we see a question there, John, while I'm letting this numbing medicine take effect.
Okay, let's go ahead and go. The next question is, So you mentioned lidocaine versus lidocaine epi versus lido epi bicarb. What do you use and how do you know which combination to use on which patient?
It just depends on your preference. I tend to not use epi as much because of its vasoconstricting effect. I lidocaine and slash lidocaine has not lidocaine slash xylocaine, same thing. 1 to 2% has just always worked for me. It has less duration. It does what it needs to do, and then it starts to clear up, and less reaction side effects with that. The bicarb and everything that kind of has a little, it kind of blunts the effect of what I want to do, and that is numb up. So I don't use bicarb as much as well. Saline is just a diluting effect. I find that the less liquid you use, the better. That's just me. So that's why I will use up to 10 cc's. Like with her so far, I used about 8 cc's of xylocaine, 1%. Okay. So that's, it's just your own preference. That's all.
Thank you, Dr. Trabani. The next question is, what company do you use to order hormone pellets? If you can recommend a company that you use.
Yeah. I personally use, as I mentioned before, I personally use Belmar. That's the one I like, but that may be one of the first ones that I used, but I just happen to like them. I haven't tried other companies, but they have just been the most helpful to me as far as when I call them, they answer. When I say I want this, they send it very quickly. Avoid pellet contracting, okay? Be careful with that because you don't really want somebody to just be sending you supplies every single month and bugging you to death. When I need something, I make the call, they send it quickly to me, okay? But Belmar, I believe I don't know if they're based in Colorado, I'm not sure, but Belmar they're on the internet, they're a great company. Check it out.
Thank you, Dr. Trabani. The next question is, are the metal tracker one-time use or you autoclave those?
If it's metal and metal, if it's the full metal trays, full metal everything, those can be reusable. You wouldn't want to dispose those because those are more expensive. So you would need a nice simple autoclave for that. I switched to the plastic disposables that only have one metal piece, and that's the beveled obturator to penetrate. Other than that, and plus they tend to be cheaper, and I don't have to autoclave. I just move on. Okay.
Do you have time to answer another question or?
Yeah, one more. That'd be great.
Okay, fantastic. The next question is, how do you know the quantity of pellets to be placed?
Okay, and that's going to be an art, but it's also going to be based on the labs. The labs, it's going to be very important because if you're drawing labs before you do any of this, and you see that, like with this patient here, her cortisol was up the roof, sky high. That's the only thing that was high because her progesterone levels were extremely low. Her estradiol levels were extremely low, and her testosterone levels were very low initially. So it was a process, but you still want to start, if somebody's got low, there's still nothing wrong with starting low to bring up because it minimizes side effects. It minimizes you getting into that danger zone, and they start noticing a little bit of, because you want to use the lowest, most effective dose. Okay. And so that's why, like with her, I may have started at, 6 to 12.5 milligrams of estradiol, very low dose, and then low 25 milligrams of testosterone and 50 milligrams of progesterone initially. Well, her symptoms, things kind of improved. So I tried to do without the estradiol the next time. And today she says she could kind of tell the difference from the last time. Now I can check labs. People go, the question is, when do you check labs? That's a good question because best would be maybe if you notice things aren't getting where you want them to, they're not feeling, then it might be a good time to check labs again. But some people would wait every other treatment, like check labs up to a year, 9 months later, maybe, to prepare you for that third last yearly dose or treatment. Okay. I think, let me see if she's numb enough, and we'll go from there. Okay. Any other questions, John?
We do have questions. Just one moment, please. Okay, so the next question that we have is PCOS. Are they candidates for pellet therapy?
Yes, they can. Yeah, it's just like with anything else, with PCOS, with polycystic ovarian syndrome, a lot of times they'll have a low progesterone state. They'll have, they can have estrogen excess. There can be a lot of issues there. They can have testosterone excess. So really, yes, they can. And yes, it can be highly effective. But once again, you need to check those labs and see where we are with that, okay? Because, that PCOS in and of itself creates hormone imbalance. I mean, it creates, so progesterone therapy, I mean, there's different things you can do with PCOS patients that actually will help with the symptoms as well, because when you're dealing with an androgen excess issue, there's a lot of things you have to do with PCOS. You can do a whole subject on that. But to answer, yes, you can do pellets with PCOS.
Okay, perfect. The next question is, how do you decide the course of hormones? How do you discern simply doing testosterone or just progesterone?
Okay. Well, like I say, it's kind of a first time go around. You are slowly improving these patients' symptoms. Okay, you are slowly improving and getting the most healthy patient you can get. So, based on other factors, I mean, if somebody has labs drawn and the estrogen's normal or low normal and estradiols here, and you've got this and that. Remember that testosterone treatment alone can get rid of a lot of perimenopausal, postmenopausal symptoms, hot flashes, other things, and mood and other things. So remember to start low. You may want to start with just low dose testosterone. You may want to start with, what has the most cancer risks? Well, it's the estrogens. So if you wanted to start with low dose testosterone, and then if there's been heavy bleeding concerns, other things like that, progesterone is a great additive, but estrogen is kind of like the last one that you may need, even though physicians, we treat it as if it's the first and only treatment that you need. And I think that that's really based on pharmacology rather than physiology.
Perfect. Thank you for answering that question, Dr. Tribani. The next question is, from time of insertion to noticeable effect, what is the typical time frame that you notice? And are there any GI symptoms such as nausea?
Okay. Rarely do I see side effects with hormone pellets because they're plant-based, they're more human, it's not horse urine, it's the real deal. It's a good, slow, steady effect. So rarely do I see, GI effects, nausea, this and that. I would say that most people, when they are getting the pellets for the first time, to answer that question, how do they feel? When do they start noticing, this and that? A lot of that depends on what I talked about before. Have they been on testosterone shots before? Have they been on androgel before? Have they been on Premarin? Have they been on estrogen tablets, estrogen patches, this and that? That makes a huge difference because you're already loading them up with high, dangerous dosages of medication. Okay, so yeah, they already feel good. Okay, and you're trying to get that down to a safety level, and give them a safe product. So they're not instantly going to feel great, okay? But if they've never been on hormones before, which I have a lot of patients that are in that shape, and that's actually the best to treat, because they just felt like, hey, I feel bad because I'm getting older. And so they just think that that's them, and that's how they're going to be the rest of their lives. But actually, those are the best ones to treat, because then you can give a low dose of testosterone, see what happens. You can give testosterone, progesterone combination, see what happens. But a lot of that is based on their labs once again. But if somebody's never been on anything for a long time, and they had a hysterectomy 10 years ago, they're going to be shocked at how much better they feel. Usually, though, it may take up to 2 months for the first with the first episode, first pellet placement.
Thank you for answering that, Dr. Trebani. The next question is, the pellets dissolve completely over time. Do you switch locations with each placement of pellets?
Yes, I do. Men, a lot of times with the testosterone, they can have it given in around the abdominal flank areas and other things, wherever you see fat. Okay, but men, there's more options swapping around and this and that. But with the women, especially, and the men, you want to alternate buttocks. Okay, you want to go from one side, then 4 months later the other side, and you want to keep track of that. You want to write it down. You want to keep a chart, keep track of what medication you gave, what dose you gave this time. You want to make sure you have all of that written down, because that's very important, because you're going to forget next time, just believe me. And so you want to have all that written down. And then you also want to make sure that you keep track of which side you did it on last time, because if you do it right and do it correctly, like we saw here, all you'll see is a little dot. You'll see a little line. So you won't remember which side you did it on either. Okay. So yeah, you alternate buttocks. Sometimes you can alternate the flank fat, the love hand, all that type of thing. You can alternate. Okay.
Thank you. The next question is, you mentioned using HCG in testosterone replacement for men. What dose do you use?
What dose do I use? Well, that depends. I mean, when you're talking about 50 to 200 to 300 milligrams, I mean, that's a kind of a tough question there. I'd have to, it's patient to patient, and it also depends on what you're seeing. I mean, if somebody's been on steroids for years and they have shrunken testicles down to nothing, HCG is not going to fix. A lot of this is based on duration of usage. Like if I've been on something a very long time, and you may not get relief with HCG. HCG will give mild relief to where you'll have to hold that androgen, hold that testosterone gel or whatever it is for a couple of days and take just HCG. Sometimes people do that in cycles, to where they are trying to stimulate their own sperm production, stimulate their own testicular function again, to prevent that negative feedback. But as far as the dosaging, that just depends. I mean, I can't really give you a straight up answer with that. Sorry.
Okay, the next question is, what is the usual lowest efficient dose of testosterone to start on?
In women, I would start on the lowest dose available. I mean, I would start, if you can start on 12.5 to 25 milligrams of testosterone. Okay. If it is a male, you would start on anywhere from 300 to 400 milligrams. So that would be 2 to 4 pellets, depending on the size. If they're 200 milligrams, you'd use 1.5 pellets of the 200 milligrams.
Fantastic. It says here, is abdomen an option?
Is what?
Is an abdomen?
Abdomen can be an option if there's not any concern about possible scarring effects and other things. A lot of times people want it back there because that's the place where it's less seen. But you do want to get into the fat, no doubt about it. you just buttock is farther away from liver than abdomen. So not that it, it's all kind of theoretical, but you don't want any kind of abdominal, effect. But I believe for the most part, people are doing that. It's going into the fat, and you shouldn't have any problem with that.
Is there an age limit?
Age limit. Well, hormone pellets, okay, are best in women. Their best perimenopausal, menopausal range. I mean, so it is older women that we're talking about, or prematurely menopausal based on hysterectomies. Okay, there's a lot of people out there that younger that had hysterectomies done. Number two, you a lot of times are basing the testosterone issue. Now, testosterone in women can be a different issue. You base that on symptoms, okay? So somebody might be in their low 40s and having flashes, feeling bad, other things. Well, trying a testosterone pellet in them is not a bad thing to try. See if it gets rid of symptoms. It's safe, and and you don't really have to follow testosterone levels in that condition because you're using such low dosages, and women have such low doses of testosterone anyway. So, but yeah, that's I think I answered that. Did I? I can't hear you there, John.
Sorry. Can you hear me now?
I can hear you.
Okay, fantastic. The next question is, I was saying thank you, Dr. Treboni, for answering that question. The next one is, in the HRT naive patient, would you give them oral replacement for a short course until the pellets kick in?
For which hormone?
It says in the HRT naive patient, will you give them oral replacement for a short course until the pellets kick in?
I would not give them an oral course until it kicks in, because you're going to get an oral fix very quickly. And so what I would do is I would start with compounding creams. Okay. You could start with the creams on the wrist and then be adding the pellets. Okay. And then you can kind of taper off the cream. That's what I would do. I mean, now some people do give a brief course of the oral agent, and that's fine. I mean, you can. It's just what's going to happen if somebody falls in love with the Premarin, then you're going to have to fight that. So I try to avoid the dangerous medications myself.
Next question. Can you counteract facial hair in women with pellets?
Yes, you can. You can have all of the virilization. You can have all of the hirsutism. You can have all of the same effects that you can have with the other medications, with oral agents and other things. It's just not as common, number one. And number two, you like I say, you're starting at a nice steady level state with the pellets, and you're following their labs, and it's much less common to see that.
Okay.
But you can. I mean, you can. It's possible.
Okay, we have two more questions. When can they expect to notice an improvement in their symptoms?
Like I said, most symptoms you should start seeing some improvement, especially first timers, 6 to 8 weeks.
Thank you, doctor.
And then and that's not every treatment. What it means is that you'll start to see that and feel really good. Then you may start noticing whether it's sex drive, libido, flash, other things. You may start seeing just a little dip in between that 3.5 to 4 month period. But it's not like you get the pellets and then you have to wait to feel good again 2 months later, 6 weeks later. Once you're in this pattern, once you get the pellets, within a couple of weeks, you should start feeling good again.
Fantastic. And the last question is, what surgical kit do you utilize for your pellet procedures?
Okay. Like I say, I use two companies. One, the one that I like the best, you would go to trocarkit.com, TROCAR kit, KIT.com. And then there's another company that's good as well, made in the US, Elemis, ELEMIS, Elemis.
Okay.
And I found those to be good as well.
All right. Thank you, Dr. Trebani, for answering all those questions. And I want to thank everyone for joining us today in this amazing course taught by Dr. Trebani. It was very outstanding. Thank you for answering all those questions and sharing all your pearls. Before we wrap it up, any other pearls or advices that you want to share with the audience?
Well, what I want you to do is I just want you to realize that because this affected me over the years, is don't just go by the pharmacology aspect of it. I've said that several times. You know, when my attendings in medical school told me this, and this, I never even knew what a hormone pellet tray kit was. I didn't know pellets existed. I thought it was just Bananaville. I thought it was just people that just do, you know, hypnosis and you know, all of these other things, acupuncture, what, you know, I had no clue about it because we were not trained on them. And it's amazing the pull of pharmaceutical companies, the pull that they have as to what is being taught in our schools, taught in our offices, you know, through drug representatives, other things. You know, it's amazing how many drugs I had over the years, that drug reps that came over to me with certain medications. And I would just say, you know, and instead of listening to the, you know, pharmacology aspects of it, I should have, don't let drug companies do your testing, do your investigations, do your brain search. Okay, you need to look into these things, and you need to find out why are hormone pellets not talked about that much? Why are they, you know, you need to look into that, because I believe it is the safest modality for women and men as far as hormone replacement. And I think you need to really do your own search for that, because let me tell you, if drug reps, if drug companies do the research for you, they're going to talk about their product, and I think that unfortunately that's what the FDA jumps on too, is they jump on the studies that these companies do that can be very skewed, because if you look at the placebo effect of a lot of studies, you will find that the placebo effect alone can be as high as 50 to 60%, which is amazing. And then they say, well, there's a 3% improvement in this and this and this. Yeah, okay, well, so it went from 50 to 53%. What, I mean, that's not much improvement in my book. I would look at stuff that is safe. I would also go back right now, when you get home, I would look at the history of Premarin. Look at the history of estrogens from the 70s on, and look at some of those studies. There was a 1 million woman study back years ago, and it had horrible, I mean, the Women's Health Organization, I mean, they had to stop some of these studies prematurely because of medroxyprogesterone from estrogen, other things. So just do your own research and investigation about hormone pellets. I will say, just from my experience, I have seen great results in men and women with hormone pellet therapy.
Thank you, Dr. Trebani, for sharing that information. I just want to remind everyone, I'm going to be sending your certificate, the forms for you to obtain your certificates next week. So please, once you receive them, fill them out, send it back to me. If for whatever reason you don't have a scanner, just print them out, fill them out, take a picture, and email it back to me. Okay, I want to thank everyone again for joining us today. And this weekend, we're going to have tomorrow other courses. Dr. Trebani is going to be with us on Sunday, answering all the questions for the medical weight loss. and he's an expert on that field, doing those procedures for many years. So please don't hesitate to send me an email if you haven't signed up for those courses. My email again is Jean, Jean @empiremedicaltraining.com. Thank you, everyone. Thank you, Dr. Trabani, and I will see you.
Can I just say one more thing?
Sure, go ahead.
I just want to say that, guys, if you have any questions, if you have anything that you want to ask, I am on Facebook under Juvenescence, Juvenescence, Juvenescence Medical Spa. And I'm also on Instagram under Juvenescence Medical Spa, or at the Singing Doc _. So if you look for that on Instagram, I'll be there. I'll be happy to try to answer any questions. And thank you guys very much. I appreciate it.